Tightness in the outer legs, hips, deep hip flexors, and glutes contribute to a flattening in the lower back. So first of all, you need to strengthen the structure of how you sit. At first, your back will become fatigued, but keep trying. Every time you sit down, thighs back and wide, sitting bones broad, lower back in a gentle curve. There's a support for the gentle curve of the knitting of the ribs in the rib cage that fans out below the pectorals or the breast. Those gently hugs in, a knit of support. Every exhale, the navel tones in to help to foster that support. When working with the outsides of the legs while sitting, you can hook your ankle on the outside of your thigh. And at first that might not be possible, but you keep trying. It's lifting, turning, ankle to outer thigh. Lifting, turning, ankle to outer thigh. If you do this on the exhale while you're sitting, you will help to engage the upper and mid and lower part of your core that supports your low back. In time, leading with your inner thighs, you'll be able to stretch the outside of your leg more. As your inner thighs goes back, your lower back will be able to go in. You never want to feel pain in the knee joint. If you feel pain in the knee as you do this, bring the knee in more laterally. The opening of the fascia will come. Working with the myofascial release ball is especially helpful. While you're at the chair, you can take the ball into the glute and roll backwards into your glute, getting into the part of the buttock that's where the bones are not. So you find the crest of the pelvis, the inner rim of the sitting bone. That's the upper and lower, glute minimus and maximus, and roll first side to side, going laterally, all the way up. Stand up and feel how it is. It's amazing the difference you can make. Just a tiny bit of that work. Now, if you're able to, you can go down to the floor. Going on the floor is a little bit more intense, but feels fantastic. All of these exercises can be done on the wall or the floor, and most of them in the chair. On the floor, it looks like this. Starting up high, just below the crest of the bones of your pelvis, and you wag your tail side to side. If you get to a place that's tight, you feel a ball of tightness in the fascia or the muscle, that's where you pause and allow your body to melt around the ball. Breath is absolutely essential. All of the fascia, all of the connective tissue pulses with your breath. Now through moving side to side, you zigzag the ball all the way down to your sitting bone. So again, that one can be done chair, wall, or floor. Working with the IT bands with the myofascial release ball can be done sitting in the chair, using your hand on the ball, pressing like this. If you're very tight, that's going to be enough. This band of fascia tends to get really, really tight. When it's really, really tight, it pulls the knee joint out of alignment. It pulls the hip and low back out of alignment. All of these exercises I'm showing you can be done in any order and sprinkled throughout the day. A little bit is more than feeling like you have to do hours every day to feel better. Just do a little bit when you take your breaks. The wall. Lean into the wall and go side to side. Going from your outer hip to just above your knee. I would say In the chair would be more of a medium sensation level. Wall, medium hot. Floor is the deepest, is the hottest, if you think of salsa levels. So you work your way all the way down. If there's a place that's tighter than other places, then spend more time there. Always remember the full breath. Getting into the back of your waistline on the floor is incredibly helpful. I showed you earlier sitting at the chair. If you're able to get down on the floor, rolling to the side, following the front of the rib cage, you roll onto the ball in the thick band of tissue, and you move side to side. So the driver is my feet. It's allowing my hips to move, and the ball itself is rolling side to side in half turns. You can go up a little bit higher and go down a little bit lower, because there's a whole constellation of effect that this more superficial muscle, the quadratus laborum, affects in the deep hip flexors, and how that serves your lower back, hips, and knees. Thank you.